To effectively sell any product, comprehensive knowledge is essential. This principle holds especially true for a product as crucial and potentially complex as insurance, particularly Medicare. Hello, I'm Amber. Welcome to Insured. Every Medicare sales journey commences with foundational knowledge, this Medicare 101 course. We will define the distinct components of Medicare and elucidate how these coverage options interact. Subsequently, we will discuss an agent's role in explaining and presenting Medicare choices to potential clients. Proceed to the next lesson to embark on your learning journey. Let's commence with a fundamental definition. What precisely constitutes Medicare? It is a federal program that provides health insurance for individuals aged 65 and older, as well as those with specific disabilities. The Centers for Medicare and Medicaid Services, abbreviated as CMS, administers Medicare. Medicare comprises 4 primary parts: Part A, Part B, Part D, and Part C. The sequence of these parts is deliberate, and I assure you there's a valid reason for it. An additional option for supplemental out-of-pocket coverage exists through Medicare supplement plans, also known as Medigap. These diverse options represent the core decisions that a consumer confronts when enrolling in Medicare. This variety of choices is intentional. It empowers Medicare beneficiaries to identify the optimal coverage that aligns with their individual requirements. However, in navigating the plan selection process, beneficiaries will rely on you as their trusted advisor to guide them. As previously mentioned, comprehending all the distinct options and their interrelationships constitutes the initial cornerstone of becoming a well-informed resource for your Medicare clients. In each subsequent lesson, we will systematically guide you through each part of Medicare, providing a detailed breakdown of the coverage they offer. We will also offer insights into an agent's involvement in advising clients on their Medicare options. Let's commence our exploration with Parts A and B, which we will consider together as they collectively form the package commonly known as Original Medicare. You may also encounter this type of coverage referred to as Traditional Medicare or Fee-for-Service coverage. Part A encompasses hospital insurance, providing coverage for inpatient care, such as inpatient hospital stays, skilled nursing facility stays, and hospice care. Part B constitutes medical insurance, offering outpatient coverage. Consider doctor visits or other healthcare providers' outpatient services, durable medical equipment, home health care, and certain preventive services. Neither Part A nor Part B is sold by agents. However, assisting your clients in understanding these fundamental building blocks of Medicare coverage helps elucidate the inherent need for supplemental coverage, which we will address shortly. Part A and Part B cover a portion of the costs for the services mentioned, but they do not cover all expenses in their entirety. Generally, Medicare covers approximately 2/3 of the cost of healthcare services for the program's 62 million or so beneficiaries. Furthermore, there is no cap on yearly out-of-pocket spending when a beneficiary is solely covered by Original Medicare. For beneficiaries solely covered by Original Medicare, without additional coverage, it can be challenging to manage medical bills and access the necessary care. According to a KFF report, 28% of those beneficiaries solely covered by Original Medicare have either struggled to pay their medical bills or access necessary care due to the associated costs. The key takeaway? Supplemental insurance coverage could potentially cover some of the services and costs that beneficiaries may not realize Original Medicare does not cover. This underscores the significance of Medicare education. Yes, as an agent, you will assist your clients in finding their ideal plan. However, throughout the process, you will likely be educating them on how the different forms of coverage function. Speaking of which, it's time to proceed to the next part of Medicare. No, you haven't missed a lesson. We are skipping over the letter C to discuss Medicare Part D. It is an optional prescription drug plan that operates independently of Original Medicare. I use the term optional loosely, as while a prescription drug plan, or PDP, is technically optional, it is coverage widely required. Medicare Part D assists beneficiaries in covering the costs of their prescription medications. Part D is accessible to all Medicare beneficiaries, but the actual plans are provided by insurance companies and other private entities approved by Medicare. This implies that yes, prescription drug plans can be sold by insurance agents. Beneficiaries pay a premium and sometimes other costs to mitigate the expense of their prescription medications. Since these needs vary significantly from person to person, beneficiaries often require assistance in identifying the most suitable options available in their area based on those specific needs. It's also crucial to note that despite the optional nature of coverage, beneficiaries may face a penalty cost if they choose not to enroll when initially eligible, but opt to do so later. As an agent, you will guide clients through the process of selecting the Part D plan that will effectively cover their prescription needs while also considering their budget. Now that we've discussed the other parts of Medicare, it's time to focus on Medicare Advantage, an alternative option to Original Medicare. Medicare Advantage plans combine the coverages from Part A, Part B, and typically Part D into a single plan. These plans must be approved by Medicare, but like Part D plans, they are provided by private insurance companies and sold by insurance agents. Insurance companies offering Medicare Advantage or MA plans are obligated to cover all the same services that Part A and Part B cover for beneficiaries on Original Medicare. However, they have the flexibility to allocate costs within the guidelines established by Medicare. These types of plans introduce differentiation within the Medicare market, enabling agents to identify the most competitive options for clients based on specific health needs. Let's delve into this a bit further. Like Original Medicare, Medicare Advantage plans still involve out-of-pocket costs. Most MA plan options introduce a network of doctors or hospitals to help reduce out-of-pocket expenses. Unlike Original Medicare, Medicare Advantage plans are required to establish a maximum out-of-pocket amount for beneficiaries each plan year. Medicare Advantage plans also offer the benefit of additional coverage that may not be covered under Original Medicare, such as dental, vision, and hearing. With another option on the table, you should begin to perceive how insurance agents assume the role not merely of selling a product, but of advising their clients on the various coverage choices. Next, we will introduce another coverage option into the mix. In our lesson on Original Medicare, we mentioned that there were certain aspects it did not cover. Medicare Supplement, or Medigap, is an additional coverage option designed to bridge the gaps in Original Medicare. These gaps refer to the out-of-pocket expenses that beneficiaries encounter with Original Medicare coverage. Medicare Supplement plans are sold by agents and provided through insurance companies. Coverage options are standardized and typically categorized by letter options. Medicare Supplement plans with the same letter offer the same benefits from carrier to carrier in almost all states. Plans with different letters offer varying benefits. Options are only standardized differently in a few states where the plans can be modified without federal approval. However, due to standardization, comparing options from carrier to carrier primarily involves comparing premium prices. Carriers can offer additional value for their plan options through premium discounts or added services like telehealth or gym membership discounts. The standardized options essentially create a spectrum of coverage choices, ranging from high premium plans that cover the most out-of-pocket costs on Original Medicare to lower premium plans that cover fewer out-of-pocket costs on Original Medicare. How do all these coverage combinations function or not function together? That's the subject of our next lesson. See you there! By now, you've likely realized that there is no one-size-fits-all option when it comes to Medicare. And that's a positive aspect, as we all possess unique health needs. However, understanding the individual components of Medicare and how they can interact or replace each other is crucial for learning to recommend the most suitable path for your clients based on those specific needs. Now that we've dissected each individual part, let's examine some of the combinations that beneficiaries can select for their Medicare coverage. Please note that we will cover these options and the reasons why clients might choose one over another in far greater depth and detail in upcoming modules and lessons. For now, consider this a high-level 30,000-foot view, so to speak. First, we'll begin with the Original Medicare route. If a consumer chooses to enroll in Original Medicare, their initial decision involves selecting both Part A and Part B. As long as they have one of these parts, they are eligible to add a Part D plan for their prescription drug coverage. If the consumer selects both Part A and Part B, they will have basic Medicare coverage, but they will still be subject to the out-of-pocket expenses previously mentioned. They are also eligible to add a Part D plan. If a beneficiary has Part A and Part B but desires to mitigate their out-of-pocket exposure, they can choose to pay the additional premium for a Medicare Supplement plan. And then, of course, they are also eligible to add a Part D plan as well for prescription drug costs. So that's what original Medicare coverage options look like. Now, let's examine the Medicare Advantage route. Instead of obtaining their coverage through original Medicare, a consumer may opt to receive their coverage from a Medicare Advantage plan in their area. At this point, the decision boils down to selecting the type of Medicare Advantage plan they prefer. Remember, all Medicare Advantage plans replace the Part A and Part B coverage of original Medicare, and the vast majority of them include prescription drug coverage, making these plans essentially a one-stop shop. There are specific Medicare Advantage plans designed to be paired with a Part D prescription drug plan, and some do not include drug coverage at all. In those rare instances, beneficiaries will either select a Part D plan or obtain their prescription coverage through another means of creditable coverage, such as VA benefits or a spouse's coverage through employment. However, it's crucial to note that in these rare cases, you'll need to verify that the MA plan will permit a standalone PDP beforehand to avoid potential headaches and late enrollment penalties in the future. We will cover this in more detail in future lessons. At this point, we've explored the basics of the parts of Medicare and how they fit together. We've also demonstrated how you, as the agent, play an integral role in assisting beneficiaries in understanding their options and selecting their coverage. If all these coverage options initially seem overwhelming, take comfort in knowing that this complexity underscores the significant value of learning these options in the first place. The variety of coverage choices enables beneficiaries to find the best fit for their individual needs, but as I've stated, they will rely on you as their Medicare advisor to guide them in the right direction. Initially, Medicare can certainly appear complex, especially while you're still in the learning phase. Later in Affirm-insured training, you will learn more about enrollment opportunities, costs, and coverage details for each of these Medicare coverage options. We will even discuss why Medicare Advantage might be a suitable choice for some, while Medicare Supplement might be more advantageous for others. Once you possess all the pieces, the puzzle will begin to fall into place. We may have concluded this series of lessons, but there are certainly more modules to explore. Review the resources below to learn more about the information presented in this module. And when you're ready, continue with your next module. Thank you for watching.